today we'd like to introduce you to chair massage. Chair massage is relatively new to massage therapy and was developed in the early 1980s to address the stress issues of our corporate world.
The massage chair is ergonomically designed to assure that our client is in a relaxed and neutral position.
The massage chair has numerous adjustment sites in order to accommodate the various body types of clients. So you may need to adjust the chair. Before you begin the chair massage routine, be sure to establish communication with your client relative to adequate pressure.
Hi Patty, today we're here for your relaxation and your comfort. So with a nonverbal sign, with a thumbs up would tell me more pressure and a thumbs down would tell me less pressure. Are you okay with that?
Yes.
All chair massage is performed with no oil and the client is fully clothed. Be sure to remember your body mechanics. Notice that Joe's weight is primarily focused on his back leg. Your strength should come from your pelvis, not from your arms and hands. Now let's begin. We're going to begin with kneading strokes on the posterior neck. These are nice, firm, deep petrissage strokes, and they should be slow and firm. We're going to go all along the tops of the trapezius and come back around into the posterior neck muscles, doing a nice slow kneading. Now we're going to do some lengthening strokes with some compression strokes on each side of the neck. We're going to gently stretch from the occipital area down in through the traps, and then we're going to compress up the trapezius area into the posterior neck muscles, using a nice slow kneading and some compression. And then go to the other side and do the same. Nice lengthening, stretching. And we're going to do some petrissage and compression strokes up the sides of the traps into the neck. This really loosens up tension and stress in this area. The next step is to gently lift the hair to expose the occipital ridge, which is at the base of the skull, right where the neck and the skull join together. This is a very sensitive area. We're going to do some nice, gentle friction along this area. So much tension is held here during the course of the day. So this feels really good for someone who's had a rough day at the office and is taking a nice break for a chair massage. Notice how Joe is going from one area to the other and not skipping across with his thumb. This is so he doesn't pull the hair. Now we'll go to the other side. We'll take it all the way across to the other side. This feels really good for the client. Takes away all that stress and tension. Now we're going to do something called gentle fascia pulling on the entire posterior neck region. This is to kind of loosen up the area. We're going to pull up the skin and just shake it a little bit. And this is really nice. It releases a lot of tension, stress, which is the primary reason for a chair massage. Stress relief. Now we're going to do some muscle isolation techniques. This is strictly optional, but a lot of times people have stress to the point where they get tension headaches because the muscles in the neck and the traps are tense and tight. So we're going to just warm the area up a little bit, and we're going to find a tight or sore area. It looks like Joe has found one.
Is that a little tender there for you, Patty?
Yes, it is.
Okay, we're going to try something to try and loosen that up. If you can, I'm going to go ahead and take the weight of that arm for you. There you go. Go ahead and relax. And we're going to shorten that muscle.
Joe is going to wait for a release, and he's going to take the arm back to neutral to see if the pain is gone.
Feel that loosen up?
Yes, I did. Thank you.
Now we're going to cool the area down with some vibration, some friction, and move on to the next location. Now we're going to move on to the back. We're going to start by doing compression strokes down the posterior back muscles, mainly on the paraspinals. Joe is using palm compression now, and notice how he's using alternating palm compression. Another thing I'd like you to notice about Joe are his body mechanics. Very, very important during chair massage. You'll notice that his weight is centered on his back leg, and with the front leg used only as a stabilizer. Now we're going to do an alternate type of compression. It's called loose fist compression. We're going to do this all the way down the paraspinals. This is where we hold the most tension in our back. Now another thing that you can do is you can alternate starting out with palm compression, and the lower you get, it might be a little bit easier on your hands and your wrists to go into a loose fist compression. We go all the way down into the sacral area. Now we're going to move up to the scapular area, or some people know this as the shoulder blades, and we're going to do compression in the scapular area. Again, Joe is using very good body mechanics by centering his weight in his pelvic region and using his arms and hands as levers rather than the strength coming from the arms and the hands. Coming around to the side of the body, Joe will pull the arm around to the back of the body, and in this case, tuck the hand in at the belt line. Sometimes clients have a hard time bringing their arm around, so you might not want to do this in every case. Joe will now grasp the anterior deltoid and grasp the medial border of the scapula and gently pull the scapula laterally, and this relieves a lot of tension in the mid-back and rhomboid area. Now we're going to go around to the other side and do the same thing again. Coming around to the side of the body, Joe will bring the arm around into the back, grasp the anterior deltoid and the medial border of the scapula, and just gently pull in a lateral direction to relieve tension and stress in the rhomboid and mid-back area. Now we're going to do something called pulls to the latissimus dorsi. Joe is going to grab the lateral edge of the latissimus dorsi and give it a gentle pull in the other direction. Now we're going to go around to the other side and do the same thing. We're going to concentrate now on the low back area, the lumbar, sacral, and iliac crest area. First thing we're going to do is do some gentle compression on the lumbar area, just gently going down all the way until we get to the sacral area, and we're going to do some compression there as well. Joe's going to be moving his hand over into the iliac crest. We will be working in an inferior direction or toward the floor. Now we're going to move around to the other side and do the same thing again, doing some light compression in the lumbar area, working our way down to the sacral area, doing some gentle compression there as well, and come around over to the iliac crest, again working in an inferior direction. This gives it a nice stretch. Now we're going to finish up the back with some gentle stroking across the back and some gentle vibration. Finishing it off with just a little tapotement. All the way down into the lumbar sacral area. Remember, this should be gentle tapotement. And that finishes our back routine. Now we're going to move around to the arms. We're going to gently petrissage the entire arm, picking the arm up, supporting it, working around the deltoid, down into those brachialis muscles, past the elbow, and into the forearm, giving a good petrissage, getting that circulation going, separating all those muscles. Let's do that one more time. Starting with the top of the arm around the deltoid, coming down into the bicep, into the tricep, those brachialis muscles, over the top of the elbow, down into the forearm, getting all those flexors and extensors, really working that area, getting that blood moving. Now we're going to take the forearm and we're going to do something called a thumb sweep up the forearm. This really works those flexors and extensors. Now if the person is hairy in any way, you're going to do an alternating kind of thumb sweep, more like a compression up that forearm. Now we're going to move into the hands. Meanwhile, supporting the arm of the client, we're working those hands, petrissaging around by the wrist, down into the palm and the upper part of the hand. It feels really good. And then working into the fingers, gently massaging the fingers and pulling, gently pulling each finger after you work each finger. This feels especially good if someone has been on a computer all day. Gives them a lot of really great circulation. Okay, we're going to put the arm back and we're going to go and move on to the other arm. Again, petrissaging the entire arm, starting with the deltoid, moving around to the triceps and biceps. Remember, our object is to get the blood moving and separating the tension in those muscles. Coming down into the forearm, getting those flexors and extensors again. Going down into the wrist. And let's do that one more time. Into the deltoid area. Down into the biceps and triceps. Over the cross brachialis muscles, past the elbow, into the flexors and extensors of the forearm. Into the wrist and into the hands. Now we're going to thumb sweep the entire forearm again. And I wanted to mention, if you're at a workplace and they want to leave their jewelry on, you'll have to work around it. But ideally, they should remove their watches, bracelets, and rings if possible, and maybe put them in their pocket. Now we're going to work into the hands, the wrist and the hands. Do some nice petrissage over the top of the hand into the palms. And gently